Happy Dusshera, everyone. It is the 25th of October 2020. These are grim times, serious times, not because of the virus directly, but because of the collateral damage by the virus. Millions of lives are at stake, millions of livelihoods are at stake, and millions would be staring at starvation very soon if we do not get a grip on this Chinese virus or the SARS-CoV-2. I talk about this today because of the fact that Dusshera is the day when Lord Ram vanquished Ravan, and today we have a virus equal in quality of being evil or being cruel, as was Ravan, despite the fact that Ravan was extremely clever and was very, very knowledgeable, very erudite, and that's the reason why Lord Ram insisted that his brother Lakshman bowed before a dying Ravan to express his respect for the knowledge in Ravan's head. So we today probably need Lord Ram to descend on earth to fight and vanquish this new enemy, which has paralyzed the entire planet and which seems even now to be having the upper hand. Now I talk about this because yesterday I saw a video conducted by Jama. Jama is the journal of the American Medical Association. It is a very respectable journal, and the chief editor who was conducting the interview is a senior pediatrician, and he was interviewing a woman. She was an epidemiologist from Harvard, and according to the interviewer, she is a highly respected person, both for her knowledge and because she's very articulate. But I was struck by the fact that both were very, very glib. Both were very the lady was almost giggling throughout the interview, and both were quite happy. In fact, the man who was interviewing her seemed almost as if there was nothing serious going around him. And this was, I found, rather odd, because it was apparent and it was obvious that these two people, very senior doctors in the United States of America, seem to have very little empathy for the millions and millions of people who are affected indirectly by the virus because of the economic impact. And in fact, now it is no longer juggling health with the economy. It is now juggling health with health, because we now realize that thousands of people have died because of heart attacks, of heart disease. Thousands have died because of cancer, because they were largely ignored by the system, or they were too scared to describe their symptoms or attend a hospital. For instance, a man would be coughing away, thinking that he had COVID-19, but actually the man would be having cancer. Another man would be having some chest discomfort and would rather hide his symptoms or just bear the symptoms at home instead of going to a doctor or going to a hospital, and probably would succumb to a heart attack. So these two people, and in fact I have a feeling that doctors in the West and even doctors within our own shores who are drawing good salaries, heavy salaries, have little knowledge, or rather deliberately have seemed to show little empathy for the struggling masses across the globe. Because a salary of a doctor in the US is in the lakhs, in double figures. A cardiologist would at least draw 20 lakhs a month, which is a handsome salary, maybe more. The average doctor would definitely draw 10 to 15 lakhs a month in the United States. You don't have to be a consultant to draw that amount of money. And when you earn that much money, then there is little cause for concern for the other chap, for the average folks. Now, I am emphasizing this again because I have been given to understand that the finance minister of England, Rishi Sunak, has made a promise. In fact, it is official now that in England, people who are affected by the tier 3 situation, that is a harsh lockdown or a complete lockdown, would be subsidized by the government. And these are not people in the government sector. These are people who are working in the private sector. It would be ensured by the English government that they are given at least 75 to 80% of their salaries. People who are in the tier 3 zones, people who are in the tier 2 zones would also get 75% of their salaries by the government. The reason is simple, because these people would not be in a situation to be working. Either their jobs would be off, or they would be furloughed, or the systems would not be working as long as this lockdown carries on. So the important fact is that the British government is prepared to provide you, despite the fact that there is no work, they would be giving you 75% of your regular salary each month. Now that is a handsome amount. Now compare this to Delhi, where there is no lockdown. There is no lockdown right now. There was a lockdown some months back. There was a sort of a semi-paralysis in the city, but now things are fine. I don't know why, because the government is not keen on a lockdown right now. Maybe we wait till the results of the Bihar elections and then the government will take over. But at present, the streets are congested. It takes a long time to drive from Noida to Gurgaon. It takes almost 1.5 hours. That means there's a lot of traffic. People are moving around, especially because these are festival times. And you can clearly see that by and large, people are not wearing masks or are not distancing. I am emphasizing this because, as opposed to the doctors who care little about people who are affected in the rest of the world, and as opposed to the British government, which has ensured that people in the private sector in England are given almost 2/3 of their salary, if not more, despite the fact that they are not working. In Delhi, where things are almost at normal levels, hospitals are working, patients are thriving, patients are coming into hospitals. The management of most private hospitals, strangely, decided to cut salaries of their consultants. And you will be horrified to know that the slashing was to the tune of 75%. Yes, it was not a cut of 20% or 15% or 25% or 30%. A cardiac surgeon had his salary slashed by 75%. Now this is a reflection of, I would say, sadism, or incompetence, mismanagement, cruelty. Maybe all of the above, maybe one of the above, but definitely one of the above, if not all of the above. I personally am inclined to believe that it is sheer stupidity. It is sheer stupidity, callousness on the part of a management which slashes a cardiac surgeon's salary by 75%. There are hospitals, there are private hospitals in Delhi, and maybe in other cities also in India, that have slashed salaries by 40% of a cardiologist or of a nephrologist. These are senior surgeons who have been going and doing their work on a daily basis. In fact, I am proud to say that right throughout the epidemic, right throughout this so-called, well, it's not a so-called, it is a pandemic. It is one of the most severe pandemics in the last 100 years, and a very, very peculiar situation in my lifetime. I made sure that I went to the hospital every day, that I looked after patients every day, that I ensured that my cath lab operated every day. And I personally have treated patients in the cath lab with acute heart attacks who were COVID positive, and I had not realized this before the procedure, but I came to know of this after the procedure. The reason is very simple. If a man comes to you with a heart attack, with an ST elevation myocardial infarction, then he is definitely oscillating between life and death. The chances of dying are very high. An untreated heart attack, the mortality would be 50% in the first 24 hours. That means if 1,000 people have a heart attack, if they are not treated, 500 would be dead in 24 hours' time. So now, if a man comes to you with a heart attack, and this would be a middle-aged man who would be having a wife, who would be having children, who would be having daughters and sons, who is responsible for the welfare of his family, you know that the man could possibly die if he's not treated. So therefore, regardless of the COVID-19 presence, regardless of the virus, you cannot wait for the PCR test, which would come back after 24 hours or maybe after 12 hours. You have to go ahead and open up the artery. So that is exactly what I was doing. And not only that, so what I'm trying to say is that the cath lab worked every day. We were looking after patients every day. And there was a time in the months of April and May when I think almost every cath lab had closed down in Delhi NCR. I will repeat that after the lockdown was made official in India, almost every cath lab was shut, either because of protocol or because the doctors themselves were too scared to tackle patients in the cath lab. I made sure that the cath lab in my hospital ran each day. I had a torrid time, I had a difficult time persuading the staff, the technicians and the nurses to carry on. I had to explain to them that yes, there is a virus. Yes, there is a virus which is called SARS-CoV or SARS-CoV, and this may produce serious symptoms, this may kill, but because you are young, because you are in your 20s, because you are in your 30s, the chances of you catching a serious disease is very, very remote, and the chances of you dying is almost negligible. But of course, this was met with studied silence, and it was also possibly not taken seriously. But the fact is, to their credit, the entire staff in the cath lab carried on working. Of course, they were given protective equipment, they were given protection gowns and visors and masks. But again, one has to salute their courage, because these were the initial days of this pandemic. I'm talking about March and April, when people were terrified. Doctors were so terrified, they were literally so petrified that they would refuse to go into the casualty to physically examine a patient who had come into the emergency or into the casualty. That was the situation in Delhi. Now, despite that, and so many of my colleagues carried on. Now, I won't say we were very brave. I won't say we were hankering to become martyrs. But the fact is that we did take the virus head on, that my colleagues did take care of patients, and they did endanger their lives. They did have families which depended on them, and yet the salaries were slashed by, as I've just said, by 40%, 50%, and as much as 75%. Now again, I will repeat, this is plain stupid, if not rank evil. I will repeat that. I think this is a reflection of small, petty minds. This is management. These are chaps who do their so-called MBAs from obscure little colleges, maybe correspondence MBAs, or people sitting in management who have MBBS degrees and have management diplomas or degrees also, who of course are confined in their offices in the hospital, who do not venture out into the wards, they do not go into the COVID wards, they do not go into the intensive cares, they do not enter the cath labs, they are not operating, but they are making the decisions, and the decisions can be very, very harsh. So I find this laughing and giggling in the video which I watched yesterday of this Jama editor with the epidemiologist from Harvard very disheartening and extremely disappointing. Apart from the science, which was not there, because the epidemiologist kept on talking about remdesivir with very little knowledge about the disease. Now, epidemiologists are public health officials who have an abstract idea, who have a vague idea about what is happening on the ground. They have literally no idea of how to treat patients. That is the responsibility of clinicians who handle these patients, and who have to decide as to whom and when to give a drug like remdesivir. Now, having said that, we will go on to some data which has appeared last week, and this is on the anti-inflammatory medicine. It is an interleukin-6 inhibitor. This is called tocilizumab. I will call it as, I will name it TCZ. Tocilizumab is quite a word. It is difficult to pronounce it, but the fact is that there is a drug called tocilizumab which has been around for many, many months. This drug is an anti-interleukin-6 drug, and this has been used in giant cell arteritis and in rheumatoid arthritis. And the drug has been successful in arthritis to a large extent. Now, finally, we have a big data of 4,000 patients published in Jama, and this is called the Stop COVID trial. And the Stop COVID trial included 4,000 patients of COVID pneumonia and compared about 350 to 3,500 patients. 3,500 patients were the control group. That means they were given oxygen, they were given antivirals, they were given steroids, and the treated group was given, apart from this, was also given tocilizumab. And what did they find? They found that mortality was significantly reduced by tocilizumab from 40% to 29%. Now, the problem with this study is that this was not a randomized study. This was a observational study. So therefore, it has little or less scientific weightage than a randomized trial. The authors did their best to keep the two groups comparable. They did what is called an inverse probability weightage statistical adjustment, so that the baseline characteristics of the patients given TCZ and the people who were given control or given usual therapy were the same, and therefore they said that yes, there is a strong signal that the drug does reduce mortality. But because this is a non-randomized trial, one has to be skeptical about the data. At the same time, we have 3 more papers which have been published. These 3 are small randomized trials, but they are randomized. So therefore, they have greater scientific weightage. One is from Italy, the second is from France, and the third is from the US. The Italian study had about 130 patients of COVID pneumonia, and it found that given COVID-19 patients who were given TCZ, there was no significant reduction in mortality and clinical outcomes. But the authors concede that the confidence interval in the study ranged from 0.6 to 1.6. Now, what does that mean? A confidence interval of 0.6 to 1.8 means that there was a chance that the drug was effective by 40% or that the drug produced problems in as many as 80% more people. So therefore, one really doesn't know from this randomized trial whether the drug was really effective or whether it was non-effective. In other words, this was a type 2 error. The other trial is a French study, again, about 120, 130 patients of COVID pneumonia, which again showed there was no difference in mortality, but there was a difference in clinical outcomes that were improved by TCZ. The third study is the American study, which has been published in NEJM. The other 2 trials have been published in Jama. The American trial again had COVID pneumonia patients. There were about 243 patients of COVID-19, and these were divided between TCZ and the usual care group. And once again, there was no difference in mortality. And the patients who were taken up were having COVID-19 confirmed. All these trials had confirmed COVID-19 by a PCR test, and all of them had pneumonia, and all of them required oxygen to some extent. And the American study, which is published in the NEJM, has shown that there is no reduction in mortality. But again, the confidence interval ranges from some 0.4 to 1.8%. That means there is a chance that the drug is not effective and worsens outcomes in 80% more people, or there is also a chance that this drug is effective in almost 50 to 60% of people. So we cannot take this as the final decision on the use of TCZ. The jury is still out. There are more randomized trials going on, and we have to wait for their outcomes. The company which makes TCZ, that is La Roche, has also given their statement in the press that they had conducted a randomized trial in which there was no difference in mortality by TCZ. So apart from TCZ and apart from the fact that the Brits are prepared to subsidize salaries in people who are not working or who have been laid off from their jobs. In Delhi, we have a situation where in hospitals, doctors who have risked their health, risked their lives in treating patients, have had their salaries slashed to the tune of 75%. Now, this I think is a huge scandal. Now, I will finish at this point, and maybe I should remind you of what I've said in my last video, and this is the fact that we are all waiting with bated breath for this magic bullet vaccine, for the silver bullet vaccine, which should be coming in after a few months. But certain facts have to be emphasized, that presuming the vaccine works in 50% of the people, and presuming that only 50% of the people take this vaccine voluntarily, this means that only 25% of the population would be effectively vaccinated. This means that 25% of the population would have neutralizing antibodies or an immunity which would be effective against a future infection. So that again highlights the fact that people who have been saying that this vaccine would be definitely effective in inducing herd immunity, well, that is not true, because we are clearly seeing or looking at a situation wherein only 25% or maybe less, 5% less, or maybe 5% more would be successfully vaccinated. And of course, we must keep in mind that this vaccine will not be developed before the end of this year or the beginning of next year. And if we take our own population, which is 1,350 million people, and if we do not presume, we know that we need 2 shots. So even if we begin vaccinating 1,000 people with this new vaccine, whether it is the inactivated vaccine, whether it is the adenovirus vaccine, or whether it is the RNA vaccine, they all need 2 shots. So that means we need 2,000 million shots. Now that's a huge number. That is 200 crore vaccines. Now it would be an impossibility to get this amount of people vaccinated within a few months. The process would go on for 2 years. Now I am emphasizing this because we have to learn to live with this virus for the next 2 years. I think it would be impossible to vaccinate 1,000 million Indians twice within a calendar year. So we have to keep in mind that we will have to live with this virus for the next 2 or 3 years, maybe longer, maybe we may have to live for the next 5 years. And the distribution of this virus and the actual process of vaccinating will be a massive logistic exercise, because the messenger RNA vaccines need to be stored at minus 80 degrees. The DNA vaccines, the adenovirus vaccines, have to be stored at the refrigerator temperatures, and the inactivated vaccine also have to be stored. Then we need to develop not only the vaccines, we need to manufacture the vials, the syringes, the needles, the antiseptic swabs, and of course we need to get to the individuals across this country. I mention this because we now are approaching Diwali. Diwali is the biggest festival of this country, just as Christmas is to the Western world. And we must listen to the Prime Minister, who has very recently officially stated that the virus is still around us and we have to keep our guards on. We cannot afford to become complacent. And despite the fact that we are approaching Diwali, and despite the fact that today we have Dusshera, we must maintain what we have been doing so far. We must practice personal hygiene, hand washing. We must wear masks in crowded places, in public areas where there are lots of people surrounding us, and we must maintain distancing. I know this will be very difficult for the people who are canvassing for the elections, but they must ensure that people who attend their rallies maintain some distance. Now, having said all this, I once again wish you a happy Dusshera and remind you that this virus will be around us for the next 2, 3, 4, 5 years, and we will, despite the fact that we have a vaccine, we will have to maintain social distancing. We may have to wear masks, and we must keep washing our hands as frequently as possible. But the good news is that, and this again I have been harping upon ad nauseum, that a lot of us have developed immunity. We have official figures of almost 30% in Delhi. Another 30% of us have T cells, which definitely protect us from this virus. So, wishing you once again a happy Dusshera, have a great Sunday, and bye-bye.